Welcome everyone. We're going to give a couple seconds to let everyone into the webinar today. We're glad you're able to join us today for our next edition of the 49er Industry Chats. My name is Noemi Guevara and I am the Director of Alumni Engagement here at Cal State Long Beach. Before we start our session today, I want to let you know that it's being recorded for viewership on demand on our website at csulb.edu/alumni. Also, we encourage you to use the Q&A box today if you have any questions for our guest speaker. And now I would like to introduce our moderator for this wonderful chat, Lucia Cos, who is a graduate of 1975 from the College of Liberal Arts, and she graduated with a degree in Spanish and was recognized as a distinguished alumna in 2005 and now serves on the CSUB Alumni Council. Thank you, Lucia, for being here, and I turn it over to you.
Great, welcome. Michael Douglas is a tenured healthcare professional and has more than 25 years experience in healthcare operations and sales. And he specializes in many healthcare services, including medical devices, home health services, durable medical equipment, and radiology services. He has held various leadership roles and currently serves as CEO of Southwest Medical Imaging, LLC. SMIL Medical Imaging is also recognized as one of the most respected radiology practices in the country, with over 35 years of advanced technology, independent research, and world-class patient care. SMIL Medical Imaging provides state-of-the-art diagnostic, medical imaging, and interventional radiology through 14 centers and three major hospitals. He holds a bachelor's degree in economics from Long Beach, class of 91, and a master's degree from the University of Phoenix. So joining us from Arizona and hosting our 49er Industry Chat, please help me welcome Michael Douglas.
Thank you, Lucy. I appreciate it. Appreciate the opportunity to speak to the alumni and students on the line.
Great. Go ahead and just jump right in, Michael.
Well, thank you for the opportunity. I think, real quickly, I'll just give you kind of a brief background for me. And then, Naomi, Lucia, if you wanted to kind of jump into some questions that you had already had, as well as any that come across from the students, I'd love to have this more conversational than me speaking at them for 30 minutes and having some questions at the end. So I graduated, as Lucia mentioned, from Long Beach State back in '91. I grew up in Orange County, California. And, one of the first opportunities I had actually out of Long Beach State was a management internship, if you will, with a durable medical company. And they'd offered me Los Angeles or San Francisco. And I think one of the tenets throughout my career has been, try something new. And so I picked San Francisco, never lived there, didn't know anybody, found it was a great opportunity to kind of learn and expand and grow. So moved up there, and that opportunity was actually found through an alumni of Long Beach State whose mother had worked at the corporate offices. And he and I were friends through kind of acquainted fraternities and sororities and things of that nature that we had met through. And so moved to the Bay Area, lived up there for about 6 years, where I also went to night school and got my MBA through the University of Phoenix while I was working for the same company. And after that, chose an opportunity to move more into a sales role with Convatec, which was a division of Bristol Myers Squibb at the time. And really got to also kind of scratch my itch for my love of travel. So I managed the Pacific Northwest. I had Northern California, Hawaii, Oregon, Washington, Alaska, Idaho, Montana, Wyoming, Colorado, and Utah. So I got to see a lot of the Pacific Northwest through my role. As a matter of fact, through all my travels with my companies, I've been to 49 states on the company dime. I only have one left to go to. And then obviously I've used a lot of my my travel points and things of that nature for international travel as well. But that was kind of my first foray out of school. I think, one of the great opportunities as a management trainee and an intern with this durable medical equipment company really allowed me to see kind of all of the workings of a company, not only from trying to get the customer and the patient and the revenue, but how do you book it? How do you collect it? How do you actually do a lot of that? So, really actually seeing how the business is done, how it was delivered, being exposed to warehouse operations, clinical operations. It was a fortunate role for me that I got really exposed to a broad swath of medical services with that first company.
So Michael, this is a good time to ask you, because you majored in economics.
Mm-hmm.
And I'm guessing you also did that with University of Phoenix, but like a lot of us, when we first come out of university, we find that we know our strength, we know what our major was, but then you end up at a place where you're learning a ton of other stuff, but you're going to marry what you learned in economics with what you're doing. So if you could talk a little bit about that for some of our listeners. Great.
Yeah, well, that's great. Thank you. I appreciate that. I graduated a semester early in December, actually. I think I finished all my classes but one and started actually graduate program economics for my master's in economics at Long Beach, much to the support of my instructors, Dr. Singh specifically. And, when I was looking at economics major professions, one of the big ones at the time was actuarial sciences. And through Dr. Singh and some other alumni, I was able to kind of get into that and look at that field, and really found that, sitting in an office crunching numbers was really not my forte. It was not something that thrilled me. Talking with people, being engaged in a business was something that was much more exciting. I think, what drew me to economics really was that, unlike my friends that were going to Long Beach that were in finance or marketing, that was really kind of focused on finance or focused on marketing, where economics was really a broad swath. We talked about finance, we talked about marketing, we talked about, trends. And so for me, it just fit better in an overall broad sense from a business perspective versus being more pigeonholed in finance or what have you. But at the same token, I think, your undergraduate degree really is a stepping stone, and it's not the be all end all to what you're going to end up doing eventually. And it was a very good base for me to understand some very core business principles as I got out into the real world. But, nowhere in college were we talking about, conflict resolution with employees in the back, in the lunchroom. And so you really kind of got to roll up your sleeves and get out there and get involved. So for me, economics was a great base from a business perspective and really helped me understand a lot of what goes on within a corporation. And especially as you move higher in a corporation, you start getting more involved into the financing, whether you're a privately held company or you're a publicly held company, the do's and don'ts of what you can and can't do, revenue recognition, and a lot of other things that in your first roles, you're really not involved in. You're really involved in day-to-day management.
So while we're talking about a life at the university,
yes,
you're talking about the 80s and 90s, and you mentioned before we started today that you didn't realize the connectivity that you make and build relationships with your professors and everyone you meet. It doesn't matter where you start in any company. Can you talk a little bit about that and how that's helped?
Sure, Lucia. I already mentioned Dr. Singh and really helping me to kind of understand, two things. One, he also had a side business. He was a professional or had a company where he connected lawsuits with, legal experts, whether that was around economics or finance or other things. And, I got to help him out in his business a little bit through my work with some computer skills. But, as I got out of college, what I didn't realize was the immense network available to me. Back then we didn't have LinkedIn, we didn't have Twitter, we didn't have all of these things that students today and recent graduates today have that are a great resource. Back then, we barely had emails. I don't even know that we had cell phones in college in '91. So, it was a whole different world. And I think, we had to work much harder to make those connections than you do today. But I would highly recommend, I still have resources from Cal State Long Beach that work in California state government, that work in alcohol distribution at a national and international level, that are lawyers, that are in commercial real estate, that are in different industries and companies that I've leaned on in my career as I've done different things, and a commercial lease comes up, I have a contact where I can talk about a term and they can tell me an honest answer or opinion that's, unfettered and unbiased, and you just know that they're going to give you the truth. So I think, finding those people that you can, and there's different levels of these acquaintances and or contacts. There's ones that I talk to every couple of years, and there are folks, probably a handful, that I talk to on a monthly or quarterly basis that are really trusted advisors that I can go to with a board problem or an employee problem or a financing problem. And they don't know the individuals here at my organization. I can tell them the situation and they can give me their honest input on how to handle something. And so, building your network is critical to your long-term success career-wise.
Right. I have a specific question. What are the job prospects for students seeking a healthcare major? Because you came in at it from economics, but you ended up at a firm that was in healthcare. So what about these healthcare majors? That people that do not aspire to be a doctor, but they consider this as a growing and really a growing field, in a world over, right? Especially right now with the pandemic and trying to bring services to the folks that need it. So what would be your suggestion to folks that are actually in that healthcare major field?
Well, I'll tell you, regardless if you're a clinician or a non-clinician, when I was back and doing my research, I looked at the Medicare population, and that was the fastest growing segment of the population and was going to be so for the next 30 to 50 years. And so, I think the healthcare opportunities are immense. There are so many environments within healthcare, whether you're talking about IT, we have folks that repair high-end equipment that have engineering degrees or clinical equipment degrees, people that don't even have a 4-year degree that go off to like an IT college or a DeVry University type of organization, and they're coming out and they're being trained to work at GE on this type of equipment. When you think about IT, you think about this pandemic and how much we've gone remote. Telemedicine right now is taking off tremendously. And so in my career, I've looked at healthcare and it's continued to expand. New drugs come out, new technology comes out. There's always going to be something out there that's the next new big thing. But at the end of the day, in my career, I've really focused more on the patient services side, actually delivering the care. And, you always need those people that are going to provide, and those teams that are going to be providing compassionate care. I don't have to be a clinician to manage that team. I need to know what they need to do. I don't need to be a clinician or an economics manager to provide my CFO or her accounting team with the types of data that I need, or the IT team that needs to provide my doctors, images and information on a very timely basis so that we can get these things back. So, when you think about healthcare, there are so many companies. There's mine that provides the care, but there are companies that provide the equipment to us where we provide the care on. There are ancillary companies that provide services to us so that we can do our job. And there are just so many different realms of healthcare that, for me, I find it fascinating. I find it very engaging. And as you get more into your business career, and you get higher up, you're dealing with boards of directors, you're dealing with investors, you're dealing with financing or lack of financing, you're dealing with the public, you're dealing with all of these different things. And what I have found value in personally is that, I get an email and I look at our patient satisfaction scores and I see these comments coming back about how someone took great care of someone's grandfather or grandmother or loved one during an illness or during a period of uncertainty, and they thank you for that care. I don't think you get that if you're making pencils or mouse pads or telephones, and so for me, healthcare has a personal rewarding perspective. It's not just the business piece and leading teams and solving problems, but it's that feedback that I get that really keeps me engaged in healthcare, and it's kept me in healthcare for all of these years.
So I think what I'm hearing, and there's a question very specifically to the tips for seeking employment, and someone else asks about gaining the skills like in customer service that can be transferable. So you've talked already about some of the transferable skills that you learned in economics and also in relationship building, and how do you might want to be able to kind of make better sense for the folks that are looking for jobs right now, how they can take what they learned at college, what they've learned in any job they've done, and what is a transferable skill, and how do you sell yourself?
Great question. And not all of us come from different backgrounds. All of us come from different sets of circumstances. And, anything you're doing in school, anything you've done to go above and beyond, I think, one of the things for me is I've always tried to volunteer for more things, tried to seek out a new opportunity, whether that was in college or graduate school or in jobs that you can speak to potential employers. If you're in college, did you volunteer and do something? Were you working part-time? Were you, being involved within your department? Were you taking care of a loved one at home and also going to school? Were you working full-time and paid completely for your college? I mean, all of those skill sets, all of those things that you do, find a way to connect that. Really, jobs are about connecting with people. We don't really, and even more so, it's harder today in an example like this, in a Zoom call. How do you connect with people? How do you bring a skill set or a point of view or a perspective or empathy or whatever it might be? You got to think about what that potential employer is looking for, and how do you connect with what you've done? Did you volunteer in high school? Were you a part of, a club in college? All of those types of other skills that folks are doing and the things that they're involved in and passionate about. How do you relate that to how you can bring that same level of skill, passion, and connectivity to whatever company it is you're talking to about doing? That's what I look for in a potential hire is, do they have a passion, and how are they engaged? How are they connected? And how can they bring that same level of passion and skill to a potential role within the company if I'm involved in that hiring process?
Okay, and I'm just going to warn everybody, my internet connection is unstable. Not me, but so hopefully I stay on. I lost half of what you just said, Michael, but I'm sure everyone else heard you. So talking again about skill sets, someone had a very specific question about what have you gained from your sales background that has really helped you? And then another question kind of talks about, do you have to brush up on healthcare and medical trends? And that I'd love to hear that too, because I'm sure
So let's hold off on that second part. The first part, in my management internship, the job I first got right out of college, I had both operational responsibility, and then I was also out with the salespeople in the afternoon. And so when I finished my graduate degree, for me, sales was really engaging, and so that's where I ended up going into a sales management role. And again, you're connecting, and you have to be able to wear a different hat. I mean, in a sales role, I could be walking in and talking to the CEO of a hospital. I could have been walking in and talking to the VP of purchasing. I could have been walking in and talking to a nurse that was potentially using our products within that hospital. And so what I really liked about the sales role is it really forced you to learn how to connect with different people in a way that made sense to them. I'm not going to talk to the nurse potentially in the same way that I'm talking to the CEO, and vice versa, of the hospital. And sometimes all of these people are in one room together. And for me, sales, what I really like about it is it's how do you find that connectivity amongst all of these different people within the same organization that you're trying to get something across, and they all have potentially different needs, wants, timeframes, budgets. That to me was a great problem to solve. And how do you figure out how to solve that? So for me, sales was really, and if you think about it, we're all salespeople. I mean, this weekend, I'm going to probably see a movie I don't want to see because my wife wants to see it. And can I do a better job selling her on the movie I want to see? Or where will you want to go to dinner? And so when I hear people put down salespeople, like I don't want to be a salesperson, I got to be honest with you, we're all salespeople. I'm a salesperson when I'm talking to my boss. I'm a salesperson when I'm talking to my team about a job or a project that needs to get done that we might need to put something else off on. I mean, we're all salespeople, let's be honest. And I think, you know, some people put down the traditional salespeople, but it's a great skill to have, and I wouldn't poo-poo it. I would embrace it and learn how to, you know, not be, and I'm not saying to be superficial or to be, you know, ungenuine, because really good salespeople do it in a genuine fashion. They, you know, they find the win-win for both the company that they're trying to sell to and their own company. And those people can actually earn quite really good money. Actually, I know some salespeople that make more than the CEOs of their companies and smaller companies. So, you know, it's definitely a skill set, and we're always selling, whether you like it or not, and pretty much everything you do all day long.
Great. And
As far as the industry knowledge, I'll tell you, I probably get access to 10 different magazines, whether they're weekly or monthly, that, you know, whether it's modern healthcare, whether it's radiology news, whether it's online magazines like Aunt Minnie, which is specific to radiology, healthcare economics. All of that, you know, ties into my job. Now, while all of it may not be germane today, you know, my job is to be abreast of what's going on in the market. You know, we're trying to provide guidance to a corporation, to a board, and to, you know, my responsibility to 500 plus employees is to make sure we're not making decisions today that lead us to a roadblock or a dead end 3 years from now. And so, you know, it's important to be abreast of your industry, whether that's healthcare, whether that's finance, whether that's banking, you name it. There are a bunch of different ways to be involved. You know, there's also executive meetings or clubs. You know, the American College of Healthcare Executives, you know, allows lots of people to join. You can sign up for the AHA website, the American Hospital Association. You know, all of these provide information to you. The Wall Street Journal usually has a healthcare section in it. Your local paper usually has healthcare one day a week or some days a week. And, you know, I would highly recommend, if you're in the healthcare industry or any industry, to be abreast of your industry. You know, the one chance you get to speak to your boss's boss in the hallway or in the elevator, and you can talk about something going on in the industry, really shows that you're more than just an employee showing up 8 to 5 and being there for the softball team, that you're invested in the industry. So be prepared, because those opportunities come along every once in a while, and you need to be prepared when they do.
Great advice, Michael, because I think for some of our healthcare major folks, they're thinking about continuing education as credit type courses, and you're saying it's beyond that.
Yes.
If you need those, you've got to get them, but you also need to be more expansive in the way you look at continuing education.
Yeah, I mean, you know, it's your education, your career is like your education. You're going to get out what you put into it. And you can choose to do the 9 to 5, and that's great. Or, you know, you can volunteer for things that require you to come in early, stay late, work weekends. But those things all go to just, you know, when someone asks, you know, how do you get those skills? You got to volunteer for them. You got to be present. You got to look for those opportunities to insert yourself, and, you know, and be present and look for those opportunities, because those may not serve you at that current organization, but they'll definitely serve you at the next organization. You know, I moved around quite a bit, probably every, you know, 2 to 3 to 4 years, other than one location where I was there for close to 8. And, I found that, finding those skills, a lot of times you have to move to kind of the corporate office, which not was something I was always willing to do, but I was able to find other opportunities and stay where I was at, from a physical perspective, a personal perspective. But yet, continue to move up in my career and be exposed to new and different things.
So what are some good tips for a recent graduate trying to land a job in medical device sales and healthcare sales?
Well, medical device sales, there's so many out there, so many different types of companies, so many different avenues. A lot of them have opportunities to, and again, it depends on what type of medical devices you're talking about. Some medical devices are sold into the OR suite or the cath lab suite in a hospital. Those are a lot more high tech. Those usually require some previous medical sales. But if you can get into medical sales, selling, kind of over the counter types of products, like, whether it's bandages or things that are sold into either pharmacies or medical distribution, that, those are more entry level. Pharma sales have changed significantly. There's a lot more entry level basic pharma where you're not selling necessarily high-end oncology or other types of drugs. But you're selling more of the base unit drugs. And a lot of those companies, you kind of come in at the base level selling a more basic product, but the better you do there, the more opportunities you have to kind of get into the higher level or the more clinical level sales. So, sales is from a product perspective. You can sell sales services. I know, long-term care, home health agencies, traveling nurses, all of those folks require salespeople to sell their services in markets and communities. So really trying to understand what's out there. Medical devices, as I mentioned, there's a wide range of opportunities there. Everything from, things that are being sold into long-term care facilities, like chucks and pads, wound care services, which aren't very high end, but can lead in, get you that couple of years of medical sales experience if that's what really excites you to be able to move into maybe more of a higher level or a more clinical level type of sales approach where you're getting to maybe orthopedics or cath lab products where you're actually standing side by side with a surgeon and helping guide them in the implanting of these devices in the ORs.
So I'm taking something straight out of your LinkedIn page. Because it kind of shows how expansive you've made what your skill sets are. And it's about trying to sell operations and business development and focusing on input initiation of building up with technology or new technologies. So so can you give them a little advice of how that's worked for you? How did you go from a very specific to more expansive?
Well, so at that first role, for example, where I was doing operations and doing some sales, basic stuff, at the time the industry was changing and there were some changes at the federal level as it related to Stark and anti-kickback. And so you had a lot of physicians that owned their own oxygen practices and they were referring patients directly to themselves. Well, with Stark and the anti-kickback back in the early 90s, they were no longer able to hold more than a 1% ownership of these organizations. So, my company at the time was coming up and trying to find these locations and trying to find these competitors and talk to them. And in my sales experience in talking with people, you start to understand who your competitors are. Knowing who your competitors are, how they operate, how they differentiate themselves from you, really helped me to connect with this VP of business development. And I was able to get him contacts with these folks. He invited me to start going to some of these meetings because I knew the local lay of the land. I knew the local opportunities. I knew what was out there. And, I didn't get paid for any of this, but, I was working extra hours to try to do some of this stuff. And from that, it kind of, gave me a broader exposure to business development, how you buy companies and how you buy and how you position the sale of a physician-owned practice and trying to buy it. And then not only buying it, then I got involved in trying to integrate it into our company and making sure that we weren't losing patients, we weren't losing the revenue that we had paid for and the EBITDA that we had paid for. So, that's just an example of trying to find ways to insert yourself more into your company's operation and not being just happy with, if you're a payroll clerk, being a payroll clerk, if you're a physician salesperson, not just understanding physician sales, but understanding the operations that support you. My job also, I wanted to know the accountants, and granted, I wasn't, and some of the other support services at the corporate level. If you work out in the field and you're not at the corporate office of whatever organization you're at, I would highly recommend making connections with the people that are supporting your region. There's an HR person that's supporting your region. There's a finance person supporting your region. There's an accounting person. There's a marketing person. There's potentially facilities leasing and support person. There might be a clinical ops person, and all of those people, the more you connect with them, they might connect you with other opportunities within the organization you may not be aware of, or that may not be posted. And again, those people are at the corporate office, and when something comes up and then they mention your name, again, all opportunities to network internally within an organization that you're already a part of. Again, back then we didn't have LinkedIn, we didn't have a lot of these resources. And I would, highly recommend that, within 5 to 10 years, if you're not connected to at least 500 people on LinkedIn, you're missing the boat.
Yeah, that's quite different from when I was. There wasn't.
And you graduated previously to me, Lucia. So
I know there wasn't even computers. I'm laughing
Right.
about it, but it is about relationships, whether they're online or offline.
It's
Yeah.
all about relationships, and it's also looking for ways to create relationships in a genuine fashion. Picking up the phone, thanking an accountant for turning a report around, or an ad hoc report that you were looking for, and just saying thank you. When you're at the corporate office, a lot of times in my roles, I'm considered what's on the thick carpeted floor, where the executives are. Take time to go down to the other floors and meet with your staff that support your teams. Meet with accountants, thank them, buy them lunch, do things that really say thank you, because nothing is done individually. You are supported by a large network of people. And, what I have found is it's much easier to work with people or deal with a problem remotely when you've had a personal relationship with them, or a personal meeting, or a thank you, a slice of pizza, a drink after work, whatever it might be, to say thank you and to connect with them. I would say, in my career, that would be the biggest advice I would give to all of you. Some of you I know are struggling to look for jobs and are anxious about that, but don't forget about, once you get the job, what do you do with it, and how do you make those connections and continue to build those connections in each and every step, role, opportunity, project that you have. That would be my biggest advice to anybody on this call, is to take advantage of those connections.
Great. I have a COVID question. So you mentioned it earlier, and just what long-term changes do you think COVID has brought and will bring to your field?
Well, we had obviously in radiology, we're kind of the middle of the pipeline. People don't come and get MRIs and CTs unless they got injured and saw their primary care physician first. And they're usually coming to us to rule in or rule out something. And usually coming from us, they're usually going off to have, knee surgery or back surgery or something of that nature. When hospitals closed down for elective surgeries, we saw our business fall off by about 50%. Mm-hmm. And so we really had to be flexible and nimble and how we responded to that. Fortunately, we've gone through a second wave in July and really didn't see a big bump in or a decrease back in our volumes. And we're going through obviously another nationwide wave now, which will probably continue to get bigger. But our volumes are continuing to maintain those same levels. But we really utilized the downtime from COVID to make a lot of operational improvements that when you're busy and you're running 110%, you don't have time to sit back and start looking at some of the minor tweaks and the little things you can be doing as an organization. So we made major changes within our IT department, our call center, our billing center, and some of our field operations. We really utilize those opportunities to get nimble, to get lean, to make improvements that we couldn't normally. COVID is a pandemic. It's a worldwide thing that no matter what industry we're talking about, we all have to deal with. I think of, some of the travel and cruise industries, those have been just absolutely decimated. Not only the cruise lines themselves, but you think about all of the small businesses that support that type of industry, whether it's flowers, whether it's the local bakery at that port, whether it's caterers, whether it's the hotel industry for the people coming in the night before or staying a night or two later. You think about the music and all of those industries, they're all, where you can't gather more than 50 people. And they're trying to find new and creative ways to do their businesses in the interim. Some people are hosting these virtual concerts. Healthcare has gone a lot to telemedicine. We still have a lot of hospitals or, referring offices that aren't even open. They're seeing their patients via telemedicine through Zoom meetings like this and referring them to us for imaging or referring them to other specialists for whatever might be needed. So, I think the healthcare industry, we're always going to have challenges. We're going to have budget cuts. We're going to have Congress trying to reduce things. But, those that can think outside the box, those that can be nimble, those that can be flexible and helping their companies find ways around it, anticipate these types of things, are going to survive in the long run. At the end of the day, healthcare is not going away. Hospitals, your primary care physicians, all, there's a whole industry around these groups that support everything that they do, and the patients are going to continue to fill those needs for the foreseeable future. For those of you going into healthcare, whether it's radiology like me, medical devices, surgical services, hospitals, home health care, long-term care, medical devices that support it, pharmaceuticals that support it, that industry is going to be strong and out there. Is it going to be like it was in the go-to-go days of the early 90s? No, but it's still a very viable, strong, healthy career choice for healthcare.
Now, you just mentioned home health care. How much are you involved with the home health care industry? Because they're asking how that's been impacted.
Home health care, again, is really booming at the moment. Patients are wanting to be seen at home. You're seeing a lot more, home health care kind of ebbs and flows. Patients want to be seen by a doctor. They go to their doctor. They want to go to, the hospital and be seen. But you're also now seeing a lot of, patients not wanting to go out because of COVID. And so home healthcare nurses, home healthcare aides, physical therapy in the home healthcare world, all of those things are really taking off because, there is a need and now a way to deliver in a cost-effective way some of the same care as opposed to coming into the office. So, if you had your choice, would you like to get physical therapy in the privacy of your own home, or would you rather drive and get into a car and be surrounded by a bunch of potentially other sick people, or that you wouldn't know if they're sick, and doing your physical therapy in a clinic? So, home health care is definitely expanding. You think about some of these diseases also, as we live older, Alzheimer's, dementia care is all also expanding at a rapid rate. As we get older and some of these diseases that, are happening, there are companies popping up, filling these needs throughout the United States, both from a national perspective and local perspective. And so, getting involved in finding these opportunities is really kind of the opportunity to get your feet into healthcare, if that's what's really your passion.
It would seem to me that some of the medical devices sales and healthcare product sales in the home for home healthcare would be, growing. And I don't know.
Absolutely. I mean, the more that's done, that first company I worked for, we provided oxygen, hospital beds. I mean, we could set up almost an entire hospital room in your home. And the care, whether it was, for post-injury or post-surgical reasons, or whether it was hospice, you were coming home to pass away peacefully in the care of your own home and loved ones and in a more comfortable environment. So all of those devices, whether it's their commodes, grab bars for your shower, to physical therapy products, I mean, all of that now, in a home environment, there are companies out there delivering those services.
And you probably have a lot of people that are family members doing home health care right now. And they need to learn how to use those devices.
Yep. Or going out and purchasing them and making those decisions. So, home health care, the ancillary care, the non-acute care world is really growing rapidly. Like telemedicine, for example. I know that there's a company out there that you can meet with your doc on a Zoom call like this and have your checkup in the comfort of your own home. So it's interesting. Healthcare is continuing to evolve and expand and grow and meld with the changing environment.
Now, here's another question that's kind of more broad. How did you recognize that it was time to leave one company and move on to another?
That was my own internal clock, when I got bored, quite frankly, or when I felt like, gosh, I have this skill set down and I didn't really see anything else. I was pretty aggressive as it related to my own career. And I really wanted to continue to grow and learn and have opportunities. And as I mentioned, sometimes at those same organizations, I had those opportunities, but I had to move to New Jersey. Or I had to move to, back east someplace, Boston, where I didn't really want to live. My entire family and friend group was up and down the West Coast. So that was a limiting factor for me. And so sometimes in order to move up, I had to move out. But I also had friends that are at those organizations that chose to move back to Boston or back to New Jersey that, got to the same level I'm at here today within those organizations. For me, it was just not something I really wanted to do. I was pretty vocal that I was able to move up and down the West Coast or have opportunities to live up and down the West Coast, but pretty much past the Rocky Mountains, I had no interest in personally. That limited my career opportunities, but at the same time, it was a choice I made personally and was happy with it. I wanted to be close to my family and friends.
So I know that you mentioned earlier about your side gig, kind of the and I thought you might want to share a little bit more about anyone that's in an industry, but if you're looking at what you want, what you like to do, and also what you might want to do to make sure that you're developing a portfolio of investments and moving yourself forward for retirement. So you talked a little bit about your side gig. Kind of explain that to our listeners.
For me, I was really looking for, not just knowing radiology or not just knowing durable medical equipment or not just knowing sales or not knowing operations. When you really think about any company, it is so much more than any one of those things. And so for me, the best advice I got and was actually from one of my early on mentors. I would suggest all of you, when you get into an organization, seek out a mentor and find someone that you can learn from, that you can, set up quarterly calls with for an hour, whether that's your CFO or some regional VP or someone that, you aspire to that role. Seek them out. Find a way to find those mentors. As I mentioned, a couple of things. One, no one's going to manage your career other than yourself. You are going to be completely responsible for wherever it is you end up going or doing. And you need to take ownership of that. And the more you take ownership of it and the more you work it outside of the 9 to 5 or 8 to 5, or for me, 7 to 6, that you are going to reap those rewards long term. Some of those same mentors that I have found, some of those same people I have hired have gone on to high roles that now are peers of mine, and I can reach out to and connect with and talk about business problems, talk about employee problems, talk about physician relationship problems, talk about a customer or a vendor relationship problem. And so, all of these aspects lead to, you furthering your knowledge of your industry. But, whether this is healthcare, you could probably take this out and call it, retail if you wanted to, how you operate, how you manage teams, how you connect with individuals. I'm a big believer of management by walking around. I don't sit here in this office and do my job 5 days a week, 52 weeks a year. I'm out in the centers. I'm out watching how our patients are being interacted with in our centers. I'm out in our hospitals and understanding what's going on with these hospitals and how radiology is a part of what they're doing. You know, I'm out with our sales team, I'm out with our clinical teams to understand. I'm meeting regularly with our OEM providers of equipment and or service to make sure I'm understanding not only what are they giving to us, but what are some of the issues that they're facing so that I can understand, you know, the industries that are surrounding my business as well. And that's how you become more marketable. That's how you can have these conversations with leaders within your organization when you get that opportunity, or when you're going to look outside of your organization at a different role. You know, you can't just talk about what you've done, but which is expected in your job description, but you got to talk about what you've done and all of the other things that surround what you do and how you're trying to reach out and grow your network, how you're trying to reach out and understand how the business runs, how, you know, finance impacts accounting, accounting, finance, human resources, marketing. I mean, all of these different aspects of a business that, you know, if you just stay in your role and just look down every day and do your job, that's great and that's commendable. But if you want to continue to grow and expand your career, you alone are going to need to do more than just put your head down and do the day-to-day job.
All right, Michael, that was a great ending because we're past our time.
Oh,
Everyone's hung in there with you. So I want to
great.
thank you, and I'm going to turn it back to Noemi.
Thank you, Lucia. And before we go, Michael, I wanted to ask if any of our listeners want to connect with you. Are you okay if they reach out to you via LinkedIn and maybe mention that they heard your talk on?
I'm happy to do so. And yes, LinkedIn is probably the only thing I'm on. Again, that's a great way to start expanding your network. So we'll see how many people actually take advantage of that.
Wonderful. Well, thank you so much, Michael, for all your great feedback and, you know, you stressing the whole networking and mentoring. And we actually just launched our Beach Nexus site, which is a mentoring platform where we want to connect students with alumni. So thank you so much for reinforcing that. Thank you, Lucia, for moderating another chat. Everyone, thank you for joining today. And again, if you want to follow, learn about future talks, please follow us on social media at CSUB Alumni. And thank you for joining us today.
Be safe, wear a mask.
Yes, please.
Yeah. Can you hold on for a second while we close out the call?
Will do.